good evening. You're watching the India Development Debate. I'm Tamanna Inamdar and I'm speaking to you on a day when coronavirus cases continue to be reported all over the world. The number is increasing as well as in India. The US Federal Reserve, meanwhile, swung into action, cutting rates by half a percentage point in the middle of growing economic threats. US markets responded to the cut. Initially in the green, and there's massive fluctuation. Right now you see the Dow Jones about 50 points up. In fact, Jerome Powell, Fed chief, will be addressing a press conference in just about half an hour that we will cut to live. You will see all of those details there, and he will hopefully be talking about the reasons for this interest rate cut. The question that follows is whether central banks across the world, including in India, will take similar measures. Meanwhile, back home, total positive cases in India stand at 6, while another 6 are suspected to be infected in Agra. 2 Noida schools were shut, and Delhi's Hyatt Regency underwent sanitisation after a virus scare. Let me tell you a bit about that virus scare just to explain the fear factor and the precautions that need to be taken. One patient travels to Italy and comes back to Delhi via Vienna. He then throws a birthday party in which several children and their parents also attend. Now, 2 schools to which those children belong have been shut. The restaurant and the hotel at which this person dined is now also under lockdown, and sanitization is taking place, which shows the severity of measures that need to be taken. So the DGCA has also issued fresh advisories saying all aircrafts arriving from South Korea, Japan and Italy will have to be disinfected as per WHO's guidelines. The biggest questions, though, continue to be that did we start flagging off and screening travelers a little too late? Remember, we had a good 2-3 weeks when there were coronavirus cases around the world, but India had none. Are we prepared enough in terms of screening passengers to ensure that none of those who are infected come in? Because the screenings at the airports are thermal screenings, and in many cases, those carriers of the virus are asymptomatic till a few days. Then the other question about detection kits. Essentially, how prepared are we? Trying to make sense of the coronavirus scare right now is Dr. K.K. Agarwal, former IMA president, Dr. A. Velumani, chairman, CEO and managing director of Thyrocare Technologies, Amit Jaiswal, CFO of Royal Orchard, and Vikas Dandekar, editor of Pharma and Healthcare, ET Prime. Welcome to all of you. I'm also joined today by Chandra, my colleague, who is giving us the global perspective of what is happening from the UK, but she's keeping an eye on everything all across the globe. So welcome to all of you. Dr. Agarwal, let me begin by just, getting your sense on where we stand, because we're seeing a sudden jump in cases, and we're also seeing maybe some loopholes in our system. For example, one of the people who have tested positive for coronavirus was in Italy but came to India via Vienna, then comes back, throws a birthday party where several children and other parents come, and now there is all-round panic. Could we have avoided a panic situation like this? Is there a question on what kind of screening is happening at our airports?
I think we have delayed in issuing an advisory regarding the epidemic occurring in South Korea, Iran, as well as in Italy. As a president of Confederation of Medical Association of Asia and Oceania, I've been talking about this. I've been raising questions that people who are coming from Italy, and specifically Afghanis people who are coming from Iran, they are at risk. So there has been a delay, because there has been a delay by at least 3 to 4 days of issuing a warning and checking people who are coming from this epidemic area. And because of that, these people have entered. Now, let's also, at this particular moment, the most important thing is that we hope that they are not super spreaders. If they are a normal spreader and if they causes mild illness, then like in Kerala, you will be able to contain the disease without any problem. But if one of them is a super spreader means like something like HIV with gonorrhea, and HIV positive with gonorrhea positive becomes a super spreader, and infectivity rate increases, like what happened in a 61-year-old female in South Korea who infected hundreds of people as a single person. Now, if this person who has been found positive in Jaipur, Italian, his wife has been also query found to be positive, and then in Agra, we have 5 or 6 cases query positive. And if you find any one of them becomes a super spreader, then we say that the disease is established in the society. If any one of them develops corona pneumonia, then we are worried. As long as they develop simple flu-like illness, we may be able to contain the disease. But if any one of them develops cough, pneumonia, then it becomes more infectious, then doctors will be at risk, the healthcare workers will be at risk, because they behave like super spreaders. So I think there has been a delay. Today, as a president of Confederation of Medical Association, I asked Indian Medical Association president, has the ministry involved and discussed with Indian Medical Association? Are you working with the ministry? He says, till today, the ministry has not involved Indian Medical Association. That's the irony of the situation.
Terrifying.
The time is for all of us to sit together, work together.
Yeah, that is just terrifying to hear. Honestly,
yes,
Dr.
Correct.
Agarwal, that is truly scary, because we need a concerted effort at this point. We've had a good run, I think, for the first month or so. And I say this relatively, of course, all human life, but India had a good run in the sense we did not see a huge explosion like Iran, etc. And everyone started thinking, oh, our weather, our immunity. But right now, when it is in the country, I mean, I don't even know if people know how to determine a super spreader from another. Just a follow-up question. Dr. Agarwal, what is your view on the screening process we have right now? Because as I understand it, airports will screen if someone coming in has a high temperature or a fever. But this can be asymptomatic for quite a few days. And then what happens if they develop the symptoms later?
Basically, government has to come out with the involvement that 269, 270 will be applicable. Any person who enters India, and if he is not, he's going to hide his symptoms. If he's giving a wrong declaration, and if he's giving, suppose he is coming to India via Iran and not disclosing it, it is a punishable offense under section 270 with imprisonment and fine. So that has to be implicated clearly, written down in every place in an airport. Everybody knows that fever is something which you can suppress by taking paracetamol. Then if you have to say to all the people who are coming that if you suppress your fever, you can be imprisoned. So therefore, all those patients who are coming and becoming positive, if they are found to not disclose information, then they should be in prison. That happening hasn't come. We haven't, till today, we haven't frozen the price of the mask. We haven't frozen we haven't got private sector into involvement as far as testing is concerned. So lots of things have to be done in the aspect of a legal aspect that need to be done on an urgent basis. I'm not criticizing the government. I'm only saying it is the time for us, all of us, to work together and do it.
No. Some of these sound quite severe. But I want to get other people's views in. We have, a variety of speakers on the coronavirus as we track this developing story. Remember, there is an impact from every angle, and we are going to look at every angle. Dr. Velumani, just, your point of view on some of the points that Dr. Agarwal has made. Number one, what I'm trying to understand is that there was a calm all of this time. Could we have taken preventive measures, even more stringent ones, to ensure that there, are no cases at all? Does there seem to be a lapse in screening? Because the first time we heard about screening from certain countries is yesterday. And clearly people have come in without adequate screening. Now what? If someone has these symptoms, who do they go to? Where do they go? There is one helpline number, but are local doctors looped in? These are very serious questions at this stage.
Yeah, there is a complexity in the entire management. Number one, multiple airports and multiple modes of entry. The next one is we were only looking at people coming from China and Hong Kong. We forgot that from Hong Kong somebody can go to Dubai and come in, or can go to Paris and come in. Now coming to some of the points Dr. Agarwal made were very valid. Number one, suppressing the symptoms. Now, that sometimes may not be intentionally suppressing. He might be controlling his fever without very innocently also. So now how to differentiate the innocent and the intentional suppression is another big issue happening. So what is challenging today is for 15 days the individual is not symptomatic. So in these 15 days, how many people he is coming into contact is another big challenge. Once we understand, yes, the symptoms, then like Dr. Agrawal said it, what other things complicate is pneumonia, any congestion in the lungs, all resulting, if there is a cough also, he is producing millions of virus outside in the form of a what you call as a droplet. So in India, once again, healthcare is not with one individual, it is with 25 states. Every state will have a different perception about it. Let me tell you, it is a very complicated game and we need to have a coordinated, concerted effort to control it.
Well, what we also need is some transparency. We've been trying to get in touch with health ministry officials. We request them once again to come in, do interviews with us. Maybe we can open up queries for our viewers and to engage with media on a regular basis, because the paucity of information creates more of a fear factor. People don't really have enough information. In fact, before we go ahead, I just want to play out this small report on very common myth busters and how they can be avoided.
Coronavirus, COVID-19. The virus has been creating a lot of confusion ever since it was reported that India has found 3 cases positive since yesterday. The school of the patient's kin has been shut. The passengers of the bus in which the Telangana patient travelled is under observation. The fear is real, and we would suggest that all of you do not believe in any WhatsApp forward that you receive or any unverified report. But let's take a look at some of the myths which is prevalent now and bust them. Myth 1. No cure has yet been found for the coronavirus. In fact, WHO earlier said that it might take up to 18 months to create one. So please do not believe on any report that says that they have a cure unless it is from the Health Ministry or the World Health Organization. Hand dryers and UV lamps are ineffective against the virus. While there were some reports suggesting that the virus is not able to sustain itself in heat, that myth has been busted by the World Health Organization. Thermal scanners are only effective after the onset of fever. While all passengers go through thermal scanners when they enter India, the scanner can only detect the virus once the patient has some fever or other symptoms of the virus. Spraying alcohol or chlorine will not help against ingested pathogens. The coronavirus is a deadly virus, and it may require much more than just spraying alcohol or any disinfectant. It's highly recommended that any person having any sort of symptom take appropriate precaution and consult a doctor immediately. No evidence yet of animal to human transmission. Many reports earlier said that the virus originated from bats. The WHO has clarified that there is nothing to verify whether transmission of the virus takes place from bats. In fact, there is no certainty that the virus is spread through animals at all. Pneumonia vaccines and antibiotics are ineffective against the virus. If you have any symptoms, we suggest you don't rest on basic vaccines or medication. We suggest you go to the nearby hospital immediately. Older people are more vulnerable to infection. While the fatality ratio of the coronavirus is just about 3%, that number goes up if the patient is older. The death recorded with patients with age between 70 and 80 is 8%, and 80 years and above is 14.8%. So that's it. These are the myths which are busted by the authorities, and we here at ET Now would highly recommend that all of you take proper care of yourself and make sure you follow all the directives given by the Health Ministry and the WHO to stay away from this deadly virus. Stay safe.
All right. Let me go across now to Amit Jaiswal. Mr. Jaiswal, you know, we have been hearing this anecdotally through the day and through yesterday about a number of cancellations at large gatherings. We know this fear came from, you know, the news of one birthday party then causing 2 schools to actually shut down for a few days. What has been your experience in the hospitality space?
See, I was listening to our respected other speakers. Let me tell you, as far as the information is concerned, India, that way we are well informed. You know, with the advent of, social media and all, we are well aware what's happening in the world. But our reaction to the informations are not up to the mark. You know, we all know that we don't have that kind of robust healthcare facilities in our country. If epidemic like corona comes into India, I'm not very sure about we will be able to handle it in a way how it has to be handled. So my only wish to the government is that they have to 100% check all the guests, all the people who are coming, from international travels through our airports. That's the first step which the government should take, which is not a very big, difficult thing to do. Every person has to be checked whenever they are coming from outside India. That is one. Second is, as a society, we have to join hands and try to keep a tab on ourselves first, whether we are doing right what is required to prevent this virus. Now, as far as the effect of this on the hospitality industry is concerned, let me tell you, already we are seeing a lot of cancellations happening. You know, across the, recently in March, ITB Berlin has been cancelled, where across the world people was able to gather for the trade fair in Berlin. That has been cancelled. Similarly, we are seeing a lot of cancellations happening in the leisure destinations. People are getting afraid to travel, which is not a very good sign.
What is the
Now, our
experience
government has
you
to
have
do
been
their
having
part
at
of
the
the work
company,
as
Mr.
well as the
Jaiswal?
civic-
Sorry to come into, just to get a specific sort of insight. What is the experience you have been having, for example, over the last few days, at your hotels, and what you've been seeing across the industry?
See, till last week, I was not that worried. I was thinking it is just a phase, and since a lot of, reporting in India was not much there. So I was keeping my fingers crossed that, this phase will pass off and the effect of this will not be much on the industry. But in last 3-4 days, things have changed, and I am seeing a lot of cancellation happening. So this month we had a very good month, November, December, Jan and Feb, as far as hospitality industry across my company is concerned. But March I have started seeing the effect. A lot of travels are, have not happening. People who are planning to travel to India, a lot of, US companies, guests and all, they have started postponing right now. Right now the stage is that they are postponing their travels. So if this doesn't get contained, then I am very worried for the first quarter. The business may get disrupted, and things may not look. Already our economy was in a bad shape, but things like this, if it comes to India, means it's a very sad news for all of us. And I am very worried for the first quarter. I think we'll have a hit. Unless and until we are able to control it as quickly as possible, then again, later part of the year we may pick up. But yes, definitely there will be a hit, and the numbers are going to be seen going forward. But we are keeping a hope that things may not hit so badly in India as it has hit in other Southeast Asian countries. But the news in last 2-3 days has been very bad. Even in Bangalore also one case has been detected in Marthalli in one of the apartment. So there is an advisory, although the government has given the advisory way back, but we are not taking it very seriously, and let's see way forward.
Vikas Dandekar is with me right now. I'm going to go back to him really in a bit. But before that, let me get a point of view from Chandra, who's been tracking the global response. Chandra, there was a meet of G7 leaders today. And the idea was to get a global response together. But far from a concerted action, it seems to be more and more of different countries shutting down their borders and figuring out ways to keep themselves safe. What are the latest bits of news that are coming in on how the rest of the world really is dealing with the coronavirus?
Right. I'm right now here in the UK, and even today, Prime Minister Boris Johnson released the action plan on how they are planning to contain the outbreak of coronavirus. Because if you look at the statistics, it was 39 people who tested positive yesterday. Today, it's risen to 51. It's sort of showing the same patterns that we've seen in other countries in Western Europe. But unlike some other countries, UK doesn't seem to be in a panic mode just as yet. They've laid out an action plan, but they are not rolling it out immediately in terms of shutting down schools or asking people to work from home or banning public events. But this is clearly causing a huge crisis in the EU region. It's spreading to pretty much every country in Western Europe. Italy, of course, is the highest, followed by Germany, France. You now have Czech Republic, you have Portugal. It's only going to be a matter of time before it spreads to other countries. Now, interestingly, people are saying that the reason why China and Singapore have been able to contain the outbreak to some extent is because of the strong state capacity that they have, the kind of authority with which they are able to clamp down on towns. Singapore's been releasing very minute details of information on who has contracted, where he's been admitted, what his network of carriers is. Will this be possible in other countries, with a more liberal democratic setup, with weaker state capacities? I think that's the concern right now. Because even if you look at Iran, today there was an update that 27 MPs have been diagnosed with coronavirus. That's, less than 5% of their parliament. But again, we don't know if that's the full story, because Iran is pretty isolated from a strategic perspective, from an economic perspective, compared to other countries. So I think each country, the way they deal with this outbreak is going to be different. China, to some extent, has been able to do it, and Singapore has been able to do it. But that's again because they have very strong state capacity. How is India going to tackle, coronavirus? We have weak state capacity. How are countries in Europe going to deal with it? We have to wait and see over the next few days and weeks, because right now it's still early days. It's been sort of spreading across countries. But this is the thing, as far as the global perspective is concerned, it's going to be dependent on each government and really how strong they are in terms of state capacity, how much of authority they are able to exert right in the early stages, and contain it and prevent it from spreading to larger segments of the population.
Absolutely, Chandra, there, summing up clearly what the world is doing and how the world is responding, a key element of this is how you detect and the number of detection kits. Let me just take you through this very short report on how these detection kits actually work.
COVID-19 or coronavirus may not be the deadliest disease, but nevertheless, it's still spreading fast. So, as the government takes all precautions to stem the virus, let's just take a look at the equipment they're using for it. The coronavirus is a respiratory disease, so the detection kit takes specimens from both the upper and the lower respiratory tracts. It contains 4 small vials packaged in a box. The test is a 2-step procedure and is minimally invasive. At the first step, the clinician places a bronchoscope through the patient's mouth or nose and into the lungs. In the second test, the clinician will swab the patient's nostril as well as the throat. The specimens are then refrigerated until they can be sent for testing.
I want to come in on the detection kits and the angle of how prepared are we. At this point, I think we will be safer if we can rule out as many people as possible from having been infected. Logically, that's what comes to mind. And clearly, just thermal screening, which is happening at airports, is not going to be enough. Specifically because you don't know if the people who've come in have then met others and there has been a spread of infection. What do you think is the preparation in terms of the number of detection kits we have right now in India, Mr. Velumani?
Yeah, I agree with Chandra, who said that Some of the countries who have managed fairly well, maybe the past experience of handling the SARS helped China to react fast, control fast. So is Singapore. But if you look at the other side, the mortality rate compared to infected rate is far high in Italy as well as in Iran. So how we rise to the challenge, are we taller than the challenge is the question. And answering to your query, how prepared are we? We are under prepared. We have only a very few government organizations who have very little capacity to do the testing. And the way in which the panic is happening, everybody wants themselves to be screened and monitored, and that needs hundreds of laboratories with thousands of test kits available. But I may not recommend monitoring and detecting and identifying is the solution. The biggest solution will come only when we isolate patients. We don't get together even at home. If there is a doubt with a particular family member, we must exercise caution. And all meetings, I heard the worry of the colleague from the travel industry. It is not today easy to go and shake hands with anyone in an event where you don't know from where he has come and how much screening has been done. So having said that, it could be 6 months, it could be 60 months. It depends upon when we conquer the virus. It is infecting fast, and we are supposed to react fast and control it and then reduce the infections. That is known as a peak point. Peak point might have reached China. Peak point has not reached in other geographies. But fortunately for this kind of viral infections, there will be a peak point, and then only we can relax. Not before that. Every measures need to be taken.
Mr. Velumani, where do you draw the line in not panicking? Because there seems to be an element of that. Is there something as too much precaution, like this case of the gentleman who traveled to Italy and then came back? Even the restaurant he dined at in a a 5-star hotel, that entire hotel has been quarantined now.
The biggest problem is the doorknobs, that the lift buttons, the mobile phones, even some nowadays people are telling currencies are also carrying. To that extent, this virus can sit anywhere and it can trouble if it is not understood. So, but my view is, we are not having 0.001% in the world infected, but the remaining 99.999% is taking away all masks and all gloves or all kind of things that is needed for control. How are we then going to control? So people have become panicked, and they read everywhere that within 15 days you are likely to have end of your life. But let me assure you, those who have weak immune response only are succumbing. Those who are old and weak only are succumbing. Remaining 98% are coming back. So people have to keep that also in mind, not to tell relax, but don't get panicked.
All right, Dr. Agarwal, don't get panicked is the message from everywhere. But the key question is that what do you do if you figure out that someone may have tested positive? Is it then necessary for everyone they have come in contact with to then be tested? And isn't that the really frightening part, that you do not know how many people could have been infected if that one person is there? Is it enough to say that it is those with low immunity, the weak and the elderly only, that will get affected? And of course, we don't want anyone to be affected.
So if you talk about the statistics, people less than 9 years, there has been no death. Between 10 to 19 years, the death mortality is 0.2%. Between 20 to 39 years, 0.2%. Between 30 to 39, 0.4%. 50 to 59, 1%. 60 to 69, 3.6%. 70 to 79, 8%. And 80 plus, 14.8%. So therefore, accordingly, precautions have to be taken by the people and the doctors. As far as the public is concerned, they don't have to rush anywhere. Talk to your local doctor and ask him, what should I do? everywhere Indian Medical Association had sent them the suggestions what to do when a patient calls up with what condition.
Mr. Agarwal, going forward, what do you think is required from the Indian government in terms of inputs? You mentioned earlier, coordination with various doctors at the local level. What about the testing kits and the detection kits? Do you think that a shortage of those would be worrisome? And on the other hand, the move we've taken today to ban the export of certain kinds of drugs, which would be then required here. Do you think that these are crucial moves?
I think once the disease spreads in the society, we will have to go the Iran way. What they did was that they will test only cases with symptomatic cases, specifically with breathlessness, who requires admission. Once, if the disease is declared as a pandemic, then cross-border mitigation has no value. Only importance will be to mitigate cases in the society, and you limit your resources and treat patients who are symptomatic, and specifically the people who are high risk, and specifically the people who have low immunity or who are a comorbid condition whose age is 60 plus. So therefore, the society has to, and today's date, if there is a fear of corona, don't go to public places, especially people who are more than 60 years. So elderly conferences, elderly meetings should be avoided, and fear has to be removed. You have to involve your local doctor. Instead of reading the WhatsApp or reading the messages, talk to your local doctor for an advice.
You know, this thought, Dr. Agarwal, that India's warm weather and high resistance will keep us safe. You are saying when we reach the peak point. Is it when or is it if?
No, it is not a question of temperature, because temperature may be higher up in one place in India, it will be lower in another place in India. So I don't think so we are going to wait for the temperature to come and take it away, because there will be areas in India where temperature will never rise more than 30 degrees. So we need to take universal precautions. We all should start a universal precautions. That means, agar aap flu se bachoge, to aap corona se bachoge, number one. Number two, Government of India should take it as an opportunity to trace each and every cough case who may have a TB. Take this opportunity, everybody who is having a cough, ask them to come to your doctor and trace those untraced TB cases, and you should be able to eradicate TB in the fear of corona.
All right, I finally have Vikas Dandekar back on. Vikas, great to have you on the show, and want to get quite a few insights from you. The first point and the first angle we're looking at right now is, of course, the preparedness of India, across states and the central government, and the amount of information and transparency which is coming in right now.
It's difficult to assess anything at present. I'm just seeing a couple of government releases. So there are multiple problems that we are facing right now on how well do we control the spread. And, given the fact that there are already so many cases, a techie from Bangalore moving to Hyderabad, then there was another instance of the Agra, of the Noida school. So basically, it's going to be exponential if we do not really take care of the containment situation. And right now, at least from the visibility point of view, we haven't seen much, excepting a couple of releases from the government, and it can actually be kind of a trigger. But we are hoping that the good thing about the whole situation is that we've had a lot of time before which we can actually prepare for the situation to go out of control. So health preparedness is something that we should have actually thought about, because every other country was getting affected. I think last we counted about 76 countries. So it was not going to be easy that India will be spared.
Vikas, I just want to get your take on two parts. One is the detection at port of entry, which right now is everyone's just focusing on screening passengers which are coming in. Now, we don't know if those who have already come in could have spread the virus. We're yet not universally screening. In the beginning of the show, Dr. Agarwal said that everyone coming in must be screened no matter where they're coming from, and there should be penalties for those who are hiding information. And the other part is detection locally in terms of availability of detection kits and information. Do you think that these two are the big risk factors?
They are actually. They are definitely, given the health surveillance system that we have. These are definitely factors which can uh, kind of be the responsible factors to let the situation go out of control. Uh, in terms of detection, we've been hearing about travelers not getting screened. Sometimes it's just a voluntary filling up of the form at the airport. So unless these things are made mandatory, who is going to tell the world that, even in Wuhan, it was seen that people actually wanted to be at homes because, once you actually go to the hospital, they would know that the situation is going to get worse. So we have to be alert about this situation right now. We don't know exactly how much is the number, but, we still feel that it's very small. Uh, Again, not to cause panic, most of the viral infection is believed to be of mild nature, and only in comorbidities where people are already having issues of health, these things tend to spin out of control. So if we have a good surveillance system, if we have a good containment strategy, one thing that one can do is to go and see the WHO website. They have actually put lots of nice pictures on the essentials, on how social distancing is going to be of utmost importance. So a couple of these things, and I think we have a lot of time to actually curb the situation.
Um, uh, that's an excellent point, Vikas, but my concern is how people are actually going to take it forward and where this doesn't turn into a panic. Right now, you have a situation in workplaces, and you're possibly seeing it the same as I. If anyone sneezes, everyone around them looks at them with extreme suspicion because, as if a big crime has been committed. So where do you draw the line? And how can we really ensure that safety measures are taken? It seems to be left too much to individual institutions, whether they're offices or schools or organizations or state governments. Do you think there are broad safety measures that the government can implement at this point on a larger scale?
See, what the government should do and probably will do is to make a mass campaign. There's no harm in alerting people because, uh, just the case of techies moving from one city to another actually can, and we are all in very crowded places. So it wouldn't take much to spark that, infection from going out of control. And in terms of hygiene and personal space and all, I mean, I very much doubt whether there will be anything that the government can do in that situation. It's very important that sufficient measures are adopted. Next day you will see hundreds of people wearing masks, and also it doesn't really help. Those little things that one should do in terms of cough or sneeze, or just washing hands. Enough has been told. So the good thing is that if in terms of the signals of what precautions should be taken, it's already known pretty widely. What the government can do is to prepare its health centers, its health preparations. We would not be able to do the kind of mammoth preparations that the Chinese government did, but given the resources that are constrained, I think we should optimally try to use them and prepare for the worst.
Okay, we'll take a very short break at this point, but we're coming right back with more of our coverage on the coronavirus and its impact in every sense of the term, whether it's markets, whether it's business, and definitely if it's your health. The biggest question we're still continuing to ask is how prepared are we for the coronavirus? Don't go away, we're coming right back. Mr. Jaiswal, just on how, as a business, are you preparing for what is coming, especially in an industry where you essentially want a large number of people in the same premises, and no one is going to want to do that right now. What is the contingency plan, and are you just waiting to write this out?
See, I'll tell you one thing, that we should not press the panic button. As my fellow panelists have told, that our immune system is much better. Okay, we have historical data to prove this, that our immune system is much better, but as well said by other panelists, that we need to take precautions whatever has been prescribed. We cannot only depend on the government to do everything, we at every level, and similarly we as a hotelier, we have alerted the button inside our hotel that all precautions are required to be taken as far as guest is concerned, as well as our internal guests, that is our employees and all. So we are taking all the steps. Precautions is the only thing which will work. Okay, as one of my fellow panelists have told, that the mortality rate is not that much as far as coronavirus is concerned. So we should not be worried that much, but at the same time, the basic hygiene and the basic things, if we are able to keep it right, I think we can fight it out. The battle is not that deep yet. I hope it should not be, but battle is not that deep yet that we cannot overcome this battle. And of course, there are a lot of talks about the industry, how industry will perform, and other hoteliers, my fellow colleagues have told that we are going to incur a lot of revenue loss and all that. I am not ruling that out, but I hope that once this March month goes, then what happens, that in summers, it is difficult for the virus to sustain
again,
the Indian summer. Most of the states in India will be quite hot.
Yeah, I just want to get a view on this. So two things, Dr. Agarwal, come in on this first. First is that Indian immunity is, better than everyone else's. Is there any truth to this, or is this something we love to tell ourselves, and that once it gets warmer, we'll be fine?
I don't. See, it is difficult to say that Indians are more immune, and that is a very bold statement. We have no scientific data. Though we agree that yellow fever never came to India, Ebola never came to India, Zika did not cause any epidemic in India. We also know SARS and MERS never created a havoc in India. But it is too premature to say that COVID-19 will also behave like that, because we already have 16 cases of COVID-19 positive in Indians in Japan ship, and we have got 5 suspected cases in Agra. We already have 6 confirmed cases. So it will be premature to digest scientifically that we are immune. We want to take this an opportunity in the country that COVID-19 scare should tell us what is cough etiquettes, what is respiratory hygiene, how to prevent flu, and we should be able to trace all undetectable TB in the history of our country. If you want to eradicate TB by 2025, this is the time. Every cough must be investigated for either in the disguise of a corona, you will be able to pick up MDR TB cases.
Let's first hope that corona stops in its track by some big miracle, because right now that seems to be the only hope. Nobody in the world actually knows what's going to happen. Dr. Velumani, you want to come in with an answer to this question? And I'm not targeting you, Mr. Jaiswal. This is something that I've been hearing through the day, and I want to believe that Indians have some superhuman immunity, because we're used to living in surroundings which may have natural viruses, and then the heat is going to save us. This is what everyone's been saying. Is there any truth to it?
I don't believe that Indians have better immunity compared to the rest of the world. That is not something which is certainly evident from the tuberculosis burden on India. If at all we had a better immunity, tuberculosis we would have managed much earlier. I fully agree with Dr. Agarwal, and I want to tell to the viewers, we are having much more death of tuberculosis for the last probably 100 years. We are unable to even control it. This deaths in virus is too little. Also, the signs and symptoms and the pains and the harassment of the virus is too high even compared with tuberculosis. So, if at all we are serious, like what he said, this is an opportunity for us to get hold of both and probably enjoy the outcome of tuberculosis in the long run. Next point is, yes, industries will suffer.
Yeah.
There is a rise in the number of infected. That has to peak. Until that time, the invested will be more stressed than the infected. So that is another big thing to be kept in mind. This is because it is ET Now channel, and I felt that the investors are under big stress than even the infected.
Well, that's a very, very good point, Dr. Velumani, and well taken. Stress is the biggest killer. And will get you whether you've traveled abroad or not. But it is our job to keep everyone informed, and I like those smiles on the faces of people here. Mr. Jaiswal, thank you so much for joining us today. Vikas, Dr. Agarwal and Dr. Velumani. But before we wrap up our special coverage on the coronavirus, the impact and scale of the fear factor of the coronavirus, because no one really knows. The mortality rates are low. It's more in elderly people who are already vulnerable. But people are just afraid to go forward with what they have planned. And it is so big that it could impact the Olympics as well. There's my colleague Vikram with these inputs.
Well, Japan could take a huge financial hit if the coronavirus persists in that path of destruction that it's been on, and Japan's dream of hosting the 2020 Tokyo Olympics, that dream could come crashing down on organizers, on sponsors, on media firms who've invested billions of dollars in the run-up to such a grand event. Overall, we're talking about a total cost of $12.35 billion US, and that could be in jeopardy. That figure includes a contribution of $800 million by the International Olympic Committee, and also it includes a spanking new stadium that comes with a 150 billion yen price tag. But it does not include a separate 3 billion yen to be spent on moving the marathon and the walking event from Tokyo to Sapporo. It's a move to avoid the summer heat. Then, of course, you have to consider the plight of the sponsors who've committed $3 billion to the Tokyo Games already. We're talking about the big guns over here like Toyota, Bridgestone, Panasonic, even Samsung. But of course, events of this size and scale, they're never taken up without adequate insurance cover, which also means that the insurers must be bracing for a big hit if the Tokyo Games are cancelled. And going by the insurance for the Summer Olympics every year, typically the IOC, the International Olympic Committee, has about $800 million of a cover against cancellation, for which, of course, it pays a hefty premium of anywhere between 2 and 3%, as per experts, which means a total premium of $24 million. And if you add TV rights and if you add sponsorships and hospitality, the total insured cost goes as high as $2 billion. And what about Japan's economy? A study says that the total spend on the Games by Japan was around 0.6% of its GDP. And with most of the spending done in 2020, Japan would spend less than 0.2% of its GDP on the Games. And while the outbreak itself would dent its tourism, the further hit that tourism would take if the Tokyo Olympics are cancelled would be about 240 billion yen. And yeah, there would be the additional loss of what tourists would have actually spent if they had been there. In 2019, tourists who went to Japan spent more than $43 billion totally. So that would be the additional hit. That, in a sense, gives you a picture of what is at stake if the Tokyo Olympics gets cancelled because of the corona outbreak. The economics of the Games are quite daunting indeed, especially against the risk of cancellation.